Actually, Dr. Yap's going to introduce our first speaker.
I'm just going to introduce the incomparable Dr. John Glees from here. So all his credentials listed. Without further ado, we'd like to experience his talk. Dr. John Glees, please go ahead.
I say change to you.
Okay, yeah.
I'd rather. Hello. Thanks very much for coming. What I'm going to talk about is a revolutionary new method for treating keloids, and that will be of interest to mother and sister without the use of surgery, mother and daughter. A revolutionary new combined treatment for aggressive keloid tumors, be they primary or recurrent, without the need of any surgery. And this is a small patient series that Dr. Kurgan kindly allowed me to present. And I do it with great pleasure because I work with Dr. Patricia Yap and our physicist, senior physicist, Dr. Henry Weatherburn. And we produced a lot together. And this work has been of great interest. Next slide. Where are you? Yeah, good. I say next to you, and if you do it, then next. Thank God it's you and not me. Dr. Yap is not only a dermatologist, but also is a chemist and has produced a wonderful cream called KeloFlat. Now, when she first mentioned it, the excitement was enormous, perhaps 2 or 3 keloid meetings ago. And I was desperate to get my hands on it because patients had nothing between giving radiotherapy. I'm a bit dizzy, so I'll sit down. Had nothing between radiotherapy treatments, which were every 3 to 4 months. And if they had itching, which most of them do, and which Frank described in his wonderful talk just now, and which all of us actually with experience of keloids have described, the KeloFlat gets rid of the itching at once. Now, in a personal communication with Patricia, I asked her, what have you put in this wonderful cream? And she said, there are other constituents, John. She didn't tell me, but other good constituents, because I've tried it myself. After a hip repair, I got a keloid, and I did not prescribe it to my patient with Dr. Yap's permission until I'd used it myself. And in Shanghai, at breakfast in the hotel, Dr. Yap asked me to take my trousers down so she could look at my keloid at the breakfast table, and I did. And she said, she nipped up to her room and got me KeloFlat, and the itch went immediately. I never had it, no itching and no pain. That was another thing. Itch and pain went. So there you see where we got to do. No, you're too fast. Wait. Go back. Is that the first one? I've also had great pleasure I'll do it together with you. Look at me. I've also had a lot of pleasure working with Henry Weatherburn, who's a physicist and also clinically very interested and astute. And we've spent, where's Henry? Oh, there. We've spent many hours together. So it's a joint project. It so happens that I'm presenting it. There are no disclosures of interest. Have we done that slide? Good. The next one, please. Now, you must know, and the patients who are here will know, and the surgeons will know, that there's a high recurrence rate with surgery alone. Surgery and radiotherapy are standard, and our Chinese colleague just now, I think he's gone. I wanted to talk to him, actually. He's gone because he said radiotherapy was not indicated in children, and that's, of course, incorrect. He's a surgeon. He wouldn't know. But the majority of children who come to us have earlobe keloids. Perfectly safe to give them surgery to remove the keloid tumor. And of course, the mothers feel very guilty because of that. The mothers have their children pierced, and they feel guilty, as Omni has told us. When she was a young girl, she couldn't give consent. The next one, it's not suitable for all patients. And what is not suitable? Limitations of surgery. And there are multiple or difficult sites, and the patient can refuse, because patients get wise to the fact, and have heard it, that every incision can cause a keloid in a keloid active, genetically active patient to recur. Next slide. There is a clinical need, an effective non-surgical alternative, which we're going to offer this afternoon, with reduced morbidity and to maintain efficacy. Now, radiotherapy. Good. Now, the mother, Omni's mother, keeps on saying to me the same sadness that she had radiotherapy in India, not that you've ever shown it to me, and you said it went very black. But my dear mother, it depends on what machine was used, what fractionation was used, what dosage was given. And of that, you've got no idea because I asked you and you don't know. So be careful what you say, because damning radiotherapy is, I'm afraid to say, not your role. You're no radiotherapist. Let's do the questions later. What do you want to say? So, okay. Well, I feel it's damned so often because, let me just say why. When Dr. Jonathan Chow gave his talk and did iridium wire implant in theater, all the surgeons leave. They're so frightened of radiation, and there's no need to be frightened. There's really no need. It depends how you give it. So basically, usually in my experience, the iridium is put in by the radiotherapist because he's not frightened. You know, we're talking about protection. So hopefully I've solved that. No, let me finish. So the radiotherapy is given with a special superficial machine. It's superficial radiation, not possibly a linear accelerator, a cancer machine that was used for your mama in India. Me. Oh, it was for you. Who had it on the shoulder? You? Yeah. Your mother pointed to her own shoulder.
I'm sorry, you do this a lot, and I want to correct you this time. I didn't damn radiotherapy.
No, you made the point. Sorry, I take it back. Yeah, we've understood. I do have an open mind. Of course, but I do. Yeah.
It feels like you go for radiotherapy first every time I've listened to you. I'm just saying.
Thank you very much. Please, let's continue with the presentation and move on.
So there's a low recurrence rate of 13 to 14%. Now, what about the topical therapy? By the way, I just got to finish this. We've got to get this straight. I don't recommend radiotherapy to everyone, just so you know. Keloflat is a low molecular weight corticosteroid cream, twice daily application, penetrates the dermis, and it's previously been discussed by Dr. Yap at our previous meetings. And here you see a picture of the Keloflat, my Keloflat, and it's a sort of very white cream, non-irritant, non-fatty, and it's very well absorbed. Now, the rationale for combined treatment approach is radiotherapy proliferating cells, which you must know, biological pathways for the drug, and the potential synergy of both of them. Now, the treatment protocol was to give 4 gray, that's a very small dose, superficial dose, every 4 months. That's very important that Omni and her mother understand that, because it's a very low dose with a very superficial, the radiotherapy only enters about 5 millimeters. It's amazing that it works. So we got a special machine that was given to me by the man that made it from his factory, because I treated his wife successfully 30 years ago for breast cancer, and he never forgot it, and he gave it me worth £1 million. In addition, we recommended, following discussion with Patricia, daily topical Keloflat for at least a year, then carry on. And I can recommend that Keloflat to you as well, if you want it.
I use it.
Good for you. If an early patient response seen...
If I may make a comment, John, what is the capacity of the patients that you can see every year? How many patients can you see in your practice every week?
You've got to talk. Sorry, I can't hear.
How many patients can you accommodate every week in your practice?
5 or 6.
5 or 6. So you cannot accommodate every keloid patient, every country under the sun to come to London to treat you. Therefore,
they all come to you.
Therefore, patients receive the radiation therapy wherever they receive it.
Right.
And this is the real world experience. This is what happens when they cannot come to you and they receive the radiation elsewhere. So let's please leave it at that.
Okay.
And we can move on with the real experience.
Said, sir.
Okay. Now, the patient cohort is small, and thanks for allowing me to present it, because we've only been doing it 9 or 10 months. Next one is the first one. This lady was seen by me. And no, just 1 second. 1 second, 1 second. I got it. She presented with 2 keloids, and she recurred in the lower one, and she was, if you see the next one, please. The next slide. This is the thermal image that Henry and I have been doing that shows the extent of the keloid prior to markup for radiotherapy. It's a wonderful new technique. We're the only ones in the world who have done this. The next one. Next one. And here you see the recurrence. And I already marked up for her the radiation field, proposed radiation field, but the insurance gave me hassle and refused to pay. And she was frightfully upset. She's an Indian lady from India. And I suggested Keloflat, and she was frightfully impressed and pleased. If we have the next one, wait, I see it. I don't want to bend. I'm completely dizzy. So if we have the next one, please, Michael. And here you see, she's used the cream for 3 months. Look at the date. That was May. Look at the date. That was in May, just a few weeks ago, to show how closely I follow these patients. And she's used it for 3 months, and she's very happy with it. And it's much flatter than it was. Remember, she had nothing really here. Next one, please. Now, this is case 2. He's a 35-year-old chap from Burma who came with his lover. I knew his previous lover as well, who'd sadly died of prostate cancer and HIV. This young man, who's a new friend at Sharma, long history of enlarging keloids with severe inching. This was intended for the radiation field, but I'm not particularly keen to irradiate the sternum in a youngish man. I can do it, but I don't have to. And I said, what about Keloflat? Next one, please. He jumped at it. This is prior to starting Keloflat, September 25. It took a bit of time to get the Keloflat from Dr. Yap. It came via Miami in the post. It was always difficult. You see these are raised and itchy, and they were irritated, couldn't sleep at night. And he was like the patient we had earlier today in Juliet's group, who said he didn't want to go swimming. He doesn't want to take his shirt off. Next one, please. Look at the date. 9/25, and this was just a couple of weeks ago, and it's practically gone. This is before. This is the result of Keloflat. Good initial result, and I've told him to carry on. Next one, please. Here you see from Roger. It says, "Dear John, Soyavan is very happy with the results, and hence he wanted some more of the magic potion. He thinks that it has greatly helped in most areas, somewhat better on his front than on his back. Either way, he thinks the improvement has been considerable, and what was a real source of embarrassment, itchiness and pain, when he had treatment to reduce the keloids, has now reduced to applying cream on a regular basis. He thinks it was a wonderful result. He's very grateful. All the best, Roger." Now, this girl, case 3, comes from Nigeria. She came with her mama. They seem to have lots of money. Because, yes, they were coming every 2 or 3 months for steroid injections into recurrence in the ear. Now, in 2020, the date, I've only seen them once, on the 4th of March this year. In 2020, she had ear piercing in Canada. Within 1 year, she developed keloids in both ears. She went back to Canada in 22. She only recurred in the right ear, not the left. And she told me the steroid injections were very painful. And she said she was so frightened of having them, but her mother insisted. The mother, of course, felt guilty because she'd pierced the ears when she was a young girl. I gave her 4 treatment options. By the way, I saw her without a letter, without a referral letter. And I didn't really know why the surgeon sent it to me, but I said the treatment options are continue with intermittent steroid injections. And she said no. But in addition, start using Keloflat, to which she immediately said yes. Mother promised she would pay Dr. Yap, but so far we've had no money from her. Number 2, offer immediate follow-up radiotherapy if one fails. Number 3, treat recurrent keloid right ear with radiation alone. And I want you all to be aware of the fact that radiation alone, without surgery, is very effective in getting rid of keloids. I've shown this before. But the radiotherapy is given every 3 months, over a year if required. She definitely doesn't want any further surgery. And the fourth option, Dr. Turgan, was to see you in New York. And she said, who's Dr. Turgan? And I said, well, he's a very nice chap, and he could possibly freeze this. But you will need several visits. So, Dr. Turgan, I want you to know, even in London, I think of you. Next one. Yes. Next one, please. She had keloid in the back of her ear too, and she and mother opted for Keloflat to be followed by 4 treatments of radiotherapy given over a year, but I've had no follow-up. But I said to the daughter, do permit me to use the first application of Keloflat. I put it on myself, and I gave her the tub, and I put the Keloflat on her ear, and gently rubbed it in. Next one, please. Case 4. Now, this young man came to me looking like this. Can you imagine, in Wimbledon? Well, it's not supposed to be funny. His appearance on his face, he looked like Peter O'Toole in Lawrence of Arabia. I thought he looked very handsome. And this is in my consulting room. He came in dressed like this. It was a warmish day. No, it wasn't, it was November, a coldish day. And I said, why on earth are you dressed like this? Why? You look like out of the movies. So I said, let's undress. Could we have the next one, please? And here you see he had the most terrible keloids. He's a highly intelligent chap, and he works in a bank. But he said no one wants to look at him, so they took him off the front desk. The next one, please. By the way, wait. Just go back one, Michael, please. Well, just back one. Won't take a second. Next, yeah. I recommended for him surgical removal of the keloids because they're terrible. He said no, he had no girlfriend. He said, no one wants to look at me. And then early 24 received 10 gray. Next one, Michael, please. Here you see he looked when I made him shave off his beard. That's before treatment, November 23. Next one. Here's the other side. Also very unpleasant. Next one. Now here you see, 1 year later, he recurred on both cheeks, 25, and that's now, March 26, completely gone. Now, how did I do it? I treated him with 3 fractions of radiotherapy over a 9 to 10 month period. He had radiotherapy on the 26th of June last year, in September and March, and started using Keloflat just before the 3rd fraction. No further radiotherapy. He thinks the Keloflat, he told me, is wonderful. He took it straight away, but of course it's only been on it a short time. But he can now face society. He looks nice. Can we have the next one, please? Next one. Here you see what he looked like in 23, and he said, now I can face the world. And he said, they put me back on the front desk of the bank. Isn't he, he's handsome, isn't he? He looks lovely. Lovely. He looked rather nice here, but there we are. Now, next one, please. Now, this is the last case, and he's very pleased that I'm showing him. He knows you're coming to look at him today, and he knows Patricia too. He came to see me with a keloid on his cheek. I asked him, when you see a doctor as old as me, you should take your cap off when you come in. Oh, he said, doctor, next one, please. I can't take my cap off. I've got terrible tumors on my head, on my scalp. Gracious, I said. He said, but doctor, nothing can be done. I have tumors growing on my head, and I wear a cap to hide these. Well, I said, I can help you with radiotherapy. Not all of them get offered that, but he did. I have to be careful what I say in front of the omnis. Now, the next one, well, I do. Next one. He actually came because of this, okay? I recommended, because they referred by the surgeons, I have to send back to the surgeon. I could treat it with radiotherapy alone. I recommended surgical excision followed by immediate radiotherapy of 10 gray. That's my protocol. Next one. And here you see I've marked it up and with a suitable margin around it. So that's all discussed with Dr. Weatherburn, who often comes into the room with me. And the next one, please, 9425, next one. And here you see our little extra arm machine that was given to me by the man that makes it. And here, yes, Mrs. Omni, given to me. And here is the extral, and he's having treatment. Treatment takes 4 minutes, doesn't hurt. This is the applicator. You see the lead cutout here. That's all customized for him. I'm in the room for about 40 minutes. I've seen the patient before. They come twice. They sign the consent, and then I see them in the radiation department with the radiographers. Right. And I'm always there when they're treated, because it's only one treatment, and I make sure that this doesn't move, because I'm doing cosmetic radiotherapy. So this is 425 last year. Next one. Now look at this. They're all gone. Omni, are you looking at this?
I am looking at
Okay. On the 21st of May, 26. Now listen to this. That was the date the photograph said. He's kissed me many times, this chap, as well as Dr. Yap. Now, on 10/11/25, he received and started Keloid cream. So he's been on it for the longest, nearly a year. Only after the second fraction of radiotherapy did he start using it. That's when he got it. To date, he has applied Keloid for nearly 9 months. This is superficial radiotherapy, first course, second course, third. The protocol says you can give 4 fractions, just 4, every 3 months. In July, he got an infected keloid, which you see sometimes, and I gave him flucloxacillin and it resolved. However, he had such an astonishing result. He didn't need the 4th treatment when I saw him on May, just a few days ago. I said, this is wonderful. Oh, he said, doctor, don't you think I should have another? I said, no. You've got to be careful with radiation in that sense. You don't give too much. That's my decision, not his. Next one, please. Isn't that super? Thank you. And that's with Keloid, and he's frightfully, frightfully happy. Next one, please. Now, the only reason I'm showing you this was also in May. He said, doctor, I think it's coming back on the back. Not at all. Can you see it's red? And he's got an infection again. So I put him on flucloxacillin. I called him before I came, and it's much better, he said. He can't really see it, and the wife wouldn't know. The next one, please. So that's what it looked like before. How did I do it? Well, I divided it into 3 fields, 1, 2, and 3. So how did I get them to disappear? Next one. Next one. This is the lead cutout with his name on it, and that's the field number 1. I included 2 large ones. So the lead, of course, protects. And it was quite difficult to see the edges because of the hair. You got no hair there, as you can see, it's come out. Next one. And here you see he's bending down and having the treatment. This is the applicator. And I'm there so that this doesn't move when the radiographers, sometimes it slips and they might not notice it. So I'm always there. And this is our wonderful extra machine that was given. Next one, please. And here, to my surprise, when I saw him, he showed me a picture with Dr. Yap. And I said, how's that possible? He's still wearing his hat, mind you. I said, how did you see her? Where is she? He said, she's in London. I said, what? I said, I immediately WhatsApped her, and she came to visit me, and I've shown her, Dr. Yap, and her husband, the radiation department. But look how happy he's beginning to look. And he said to me, Dr. Glees, Dr. Yap's treatment's marvelous. It's made them disappear. I said, hey, you're not right. It's the combined treatment that's made them disappear. No, I said, you're not to love her too much. You've got to love me a bit too. Because actually the radiotherapy is enormously effective. And I got to let you into a little secret. Yeah. Dr. Yap has asked me and Henry to come to Jamaica to teach them how to give radiotherapy to non-cancer cases, because these are low doses and they're superficial treatment. Next one, please. See the date? And that was, isn't he wonderful? Yeah. And no hat. And they've all gone. And his hair's sort of grown a bit. And he's so happy. Now, what have we learned from this joint collaboration? Next one, please. Oh, by the way, I like to talk to the surgeons. I would have loved to have been a surgeon myself, but one of the surgeons said, your hands aren't good enough, Dr. Glees. Not for surgery. You're too... Anyway, I sent the surgeon, Dr. Apostolos Vlachogeorgios, who works at UK Skin in London, Harley Street. Dear Dr. Glees, incredible result. I can't even imagine how this guy feels right now. Congratulations to you and your team. Best regards. Of course, I was pleased, Dr. Yap, to get that. Can you imagine? What a wonderful letter. Wonderful letter. Next one, please. We're coming to the end, Michael. What?
Your microphone.
Oh, we're coming to the end, Michael. Now, the early outcomes, patient outcomes at about 9 months, improved in all cases, minimal toxicity, almost immediate itching relief, surgery avoided completely. Next one. No severe toxicity, combined treatment well tolerated. Next one. Consistent regression may support a combined approach in future. Let me tell you, when you give radiation every 4 months, that's the protocol, and I have to be very careful with the dates, put it in my diary. There's lots of organizing. I do all that myself. I work hard, but enjoy it. And the patient comes in, he has a space allocated on that day at that time to come. But the nice thing is they can apply the cream every day. So the patient psychologically has the feeling, and it's true, they're treating their keloid problem every day with the cream. Next one. Conclusions. Keloflat plus SRX superficial radiotherapy is an effective, non-surgical option for recurrent as well as primary keloid treatment. It avoids surgery. Surgery, as all the surgeons here know, by putting a scalpel in the skin, it excites keloid fibroblasts and keloid formation in those that are susceptible. And the results very early results are promising. Next one, Michael, please. Potential paradigm shift, query revolution, the OMNI, revolutionary. Reduced mobility, improved patient acceptance, follow-up audit results will be presented next International Keloid Symposium. Now, I've got to make an apology for you. I'm going to make an apology. Just hear this. I want to make an apology. Can you get me with me? Thanks. I want to apologize yesterday when discussing recurrences that I told you that patients just got in touch with me if they have a problem. They all have my mobile number, my personal mobile number, and they have my email. They don't go through some secretary or some admin, they come to me. However, before any audits are undertaken or published, my policy is to contact directly all patients involved. My feedback is proactive, and therefore the recurrence rate we are reporting at 13 to 40% is 5 to 6 years. Someone cross-questioned me and said, where's the data? She went on and on. I don't know if she's sitting here. But these are all personal things. Every patient I see, I got an exact knowledge of where they are and what's happening to them. Of course, it's a lot of work, but I like it. Let me just finish this. This has been verified by Henry Weatherburn, Dr. Weatherburn, so that publication can go ahead. And again, all patients can directly contact me and do so prior to any audit being done. I wanted to make that clear, so thanks for listening. Next one, please, Michael. What summary? These are my thoughts. Radiotherapy given every 3 months. Response takes time. Radiotherapy helps itching, so they get immediate help with Keloflat because the radiotherapy takes time. I had to tell them all, it takes time. You may need 2 or 3 or 4 treatments over a year. Keloflat gives instantaneous relief. Often dual therapy has been found to be more effective than monotherapy. And this, of course, applies to cancer treatment as well in chemotherapy. The combination chemotherapy was a major advance from being single drug therapy. Keloflat is used twice daily, morning and nighttime, very gentle and so on. Patients like the thought of daily application of Keloflat because until now they really were offered nothing. Next one, please. Where can they buy it? That's what they say. Dr. Yap will attest, steroid injections, wherever placed in the body, are very painful and stressful, and patients are anxious at the thought of those. Dr. Yap is experiencing Keloflat used together with steroid injections, and she's shown us that at previous remarkable responses. Dr. Yap has told me in personal communication that she would value the addition of a radiotherapist to teach her young radiotherapist in Jamaica to give radiation for a 9-keloid condition, which has seldom been possible. And what I love with Dr. Yap, we both appreciate each other's work. Henry, that's true, isn't it? We do. And she offers something very special, and so do I. Well, we all do in our own ways. And of course, Michael Turgan's correct. I'm not pushing radiotherapy forever. Good God, I couldn't manage it. As he never fails to knock that into me. But I know that in a way, the treatment with radiation can be miraculous for patients. I'm not talking for me. I tell the patients I don't need it to do this job for money. I don't need the money. I like doing it. I like helping. For this reason, Dr. Yatt suggested that Henry Weatherburn and I should travel to radiotherapy centers in Montego Bay and Kingston and teach the radiotherapists there how to treat keloid tumors and keloid scars. And I want Jonathan Soud to come with us, and possibly also his wife, Monique. And I asked Dr. Yap, and she said, yes, you're all welcome. So they would be very lucky to have us. Next one, please, Mark. We're nearly done. That is it all? Thank you very much.
I didn't hear my name for the invitation to Jamaica.
No, yes, yes. Are there any questions? But
Questions for,
will you do it, madam? I can't run. I'm too tired. Too tired. Yeah, you take it. I don't know if anyone wants to. Omri, I hope you've got a question for me.
It's okay.
Okay, I have a question. You had a keloid
Where are you?
up here. You had a keloid and you didn't radiate it yourself.
Sorry?
You said you had a keloid, you even had to drop down your
I'm not showing
pants.
you. It's here.
Yeah, and you
It's
didn't.
tiny. But it itched like hell.
So why didn't you radiate it?
Well, because I didn't want to. Radiating myself's awkward. I could have.
Okay, I've made my
Hey,
point.
listen, no, you haven't made your point. Listen to me. Listen. I wanted to use it on its own to see whether it was any good, and it's good. I didn't release it to my patients until I proved that it worked on me. It's reduced my keloid by 70%. It's practically non-visible, so I don't need radiotherapy. So you haven't scored a point. You have not. Next one.
next question.
Over here. Thank you, Dr. Glees, for the presentation. It's interesting to see your experiences and what probably reaffirms your belief as to what the most effective treatment is. This is perhaps a question for Dr. Yap as well, but I might have missed the last year session, so I'm not sure if we know the makeup of the kilo.
What's your question, actually?
I'm getting it. Yes, correct.
Can you
So
come to
kilo
it?
flat. So
I fall over.
So my first question is, what is in kilo flat?
Okay, the kilo flat is really just a steroid, but I, like Dr. Albert here, from 2002, I've been using this method to treat my patient. I just didn't know that it's that difficult because I just keep using it. And my sister, who's very versed in IT, said, hey, there's a keloid conference. Maybe you should go and let them know that you have this. So I did. And then, of course, in the bigger country, you have all those titles behind your name. You can go to the farmer and get sponsor. I sponsor everything myself. It's just a curiosity to treat my patient because in Jamaica, 99.9% are Black. And those that think they are not Black, they just don't know it yet because genetically they are Black. So if I can't treat keloid, I might as well go back to my family business, which is restaurant, because these are the things I need to treat. Because when I studied in London as well for dermatology, because in those days, you have to kiss the ring to get it. So I did. So I went there, did my dermatology, but in my entire year, I only saw 10 Black patients. So I understand the basic dermatology affecting everybody, but I have no experience in treating Black skin. So when I went back to Jamaica, I have had to create all the medication to treat my own people. So this was one of them. But I would like to monetize it now, as my sister said. You've been subsidizing all these years. So it'll be out next year. Because wait. I don't think you understand this. Because I did go to all the farmers, including Galderma. I went to all the meetings. And when they told me the amount of fundraising I will have to do along with a hedge fund, I said, no, that's not possible.
Dr. Yap, sorry, I'm really sorry to cut you off, but I just have a very specific concern that I have, because I understand that fundamentally it is a steroid.
Yes.
And obviously, as other physicians might have this concern, is obviously patients have been using this steroid for many, many, many months. And
Yes.
It seems like the plan is to continue using them. And obviously, my concern is the risk of overuse and withdrawal for these patients. That's why I want to know.
Are you a dermatologist?
No, I'm not.
Well, that's why you wouldn't understand.
So perhaps.
Dr. Albert,
Okay.
one
all right.
minute, it's my turn.
Yeah.
Dr. Albert, you're a dermatologist, and I'm so happy there's many dermatologists here. I first define keloid is not a tumor. It's a chronic relapsing condition affecting the fibroblasts resulting in a tumor in the dermis. That's the same definition. If you were to describe a psoriasis, that's why it is not a tumor. It's a dermatosis. They do come back if the condition is right. So for this patient, that Burmese patient, I told him, I said, look, you have keloid because of acne, and you still have active acne in your back. If I were in London and I'm your dermatologist, I would give you a course of Accutane because that is what is your source of irritation.
Can I just mention, I want to say something.
No worries, because I checked for the Cushing syndrome.
May I make a suggestion? May I make a suggestion? Can we go to the next question, please? We can take this conversation outside. There's plenty of time, and we can have a
Let's take the sword fight.
conversation about that.
And I
Next question.
So just thank Omi for reminding us all to keep an open mind about everything.
Absolutely. We need to have an open mind towards everything.
Any other questions?
Next
Dr.
question,
Glees.
please.
I've never seen any problems with steroid withdrawal from using cream. Have you? Never. No. Well, I don't know what you're doing then, but they're small areas.
The point is well taken about steroid withdrawal, but we'll take it outside and we'll
Okay,
discuss
we
it.
will.
Okay, it might not be clear, but I've also used Keloid Flat, and I used it consistently for about a year. I'm still using it, but at the moment I use it off and on because it creates hypopigmentation. And Dr. Yap told me, the minute you see hypopigmentation, stop using it. And the minute you stop using it, your pigmentation will come back. And that's exactly what happens. And the minute it starts itching again, start using it again. So I am using it long term, and I've been using it since 2023. And I haven't had any side effects, which is what you're asking about.
Okay, and how effective has it been for you?
Okay, for me, it has been effective and not effective, if I'm being honest. At first, when I was using it, and Dr. Yap tells everybody this, it's not an overnight use. You have to use it consistently for a period. And I did use it consistently for about a year, and it worked miracles on some of them. So like on this particular keloid here, you can see this part is bulky, but this part is flat. And she got that part flat. It was the keloid flat that got this part flat. The whole thing was bulky, but not as high as this. But this part didn't respond to it at all. And it's the same area even. Whereas, and I have other parts that went almost completely flat and other parts that haven't responded, like on the back of my ear went flatter, but this part all the way up here didn't go flat at all. So it has worked in areas and hasn't worked in areas.
All right.
But where it is amazing, I'm sorry, I can't say this many times, is the fact that the itching and the pain is reduced significantly. When I came into Montpellier, I wasn't sleeping at night. And I can sleep through the night now. So it is amazing for the pain and the itching. My itching isn't completely gone, but it is amazing. I can live with what I have.
Right. Thank you. Thank you very much for sharing your personal experience. Let's move on to the next presentation. Then we need to take a break, and then we continue power through everything. Is that okay? Okay.
Okay, so our next speaker is Dr. Chung-Hui Shi. Do you have the microphone?